Today I will be demonstrating a reflection of my portfolio project for my discussion post this week. I have completed a portfolio project the entire duration of being in this course. I did create a bibliography in regards to DNRs and advanced directives and how important they are. I did touch base on a certain scenario that had to do with a mother that became ill and was sent to a healthcare facility, and the daughter was left to come up with all the decision-making processes and the DNR, or, do not resuscitate. She had to sign all those paperworks, and the mother was sent out to the hospital, and, some situations happened and things weren't followed the way the daughter thought that they were going to be followed. But see, the healthcare team did not really describe how everything was supposed to go. So sometimes things in the healthcare field can be very misleading. But while I was able to come up with my annotated bibliography, I did have some thinking strategies that I used prior to creating this portfolio project. I was able to take notes from previous lectures during the course. I was also able to be able to do my own research prior to creating this portfolio project, just to make sure I had all my P's and Q's and all my ducks in a row before I started writing this. Now, when I write papers, especially essays or any other form of papers in regards to school in general, I just write. I don't do any kind of, I guess it would be, writing a piece of paper that might be my essay and then rewriting another piece of paper and then rewriting another. No, I write the entire paper. I go through, I read, I proofread, I correct any errors, I go through, I type it into Microsoft Word, and then I check the document. If I don't like anything that's in it, I delete it, go back, and add something that I do like. Now, within my studies, I was able to find some very good works cited things that I was able to add to that works cited page. So there were a lot of different documents that I was able to read to provide more information upon my completion of my portfolio project. Now, when it comes to writing my papers, like I said, I like to imagine in my mind what I would like to write about before writing the initial paper, before editing it on my own. Now, when it comes to correcting my errors and punctuation, I do like the aspect of being able to type everything into Word processor, and I like to be able to see my errors, and they kind of point out how I could reword things a little bit better, and that does help me as a writer as well. Now, when it comes to the workplace capabilities, I was able to pick the 3 that I do see fit that I can use a little bit better. Everybody chooses 3 different ones, but my 3 that I chose were tolerance, which was one of the ones that we had to choose. Tolerance. The second one was interpersonal skills, and the third one was information literacy. Now, the way I was able to use the tolerance part of the workplace capabilities was in relating to my project. Everyone has their own personal opinions. Now, so being able to write about, talk about, or even act on these personal opinions, you have to, in the healthcare field, when it comes to your own as a physician, as a nurse, as a doctor, anything. When it comes to your own personal beliefs, you kind of have to put those aside and focus on the patient's personal beliefs. A lot of people, and I've seen nurses do it, they like to spoon feed the patients. Oh, well, maybe you should read the Bible more often, or, do you believe in God, or, do you have faith? Do you have some sort of religion that all those questions are asked upon admission. The nurses should not have any aspect or any, I don't think they should be involved in that. So, when talking to about personal preferences, it takes skill to remain non-judgmental and to maintain your sense of professionalism. Now, for the second workplace capability for the interpersonal skills, one interpersonal skill that relates to my portfolio project in general is showing empathy and understanding when it comes to patients and their family members choosing to do the DNR and the advanced directives and how everything is going on with that. When someone chooses and goes through the signing or the DNR signing process, in other serious situations such as going through having to choose whether a family member is going to be on hospice, other certain situations, you must be able to show empathy and understanding. And there's a difference between empathy and sympathy. Sympathy is, showing your feelings, like being sad for that person. Empathy is putting yourself in that person's shoes. A lot of people don't do that. In the healthcare field, you have to. You have to be able to put yourself in that person's shoes. If that was my mother, would I want her to suffer or would I want her to be happy? That's how you have to look at those things. Now, another one would be the information literacy. Like I said, I was able to put a lot of stuff on my Works Cited page. Now, I was able to find a lot of proper resources to use for my portfolio project. And I was also able to keep the portfolio project written as a professional college level portfolio project document in regards to the healthcare field of work. The healthcare field is hard. The healthcare field is demanding. Please, 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 if you're entering into the healthcare field, be passionate about what you're going into. I've been a CNA for almost 5 years now, and it takes a lot of passion, patience, and empathy. Don't sympathize, empathize. I hope y'all enjoyed my reflection. I know I said a lot of ums, and I may not have been as perfect, but I try to be as honest as possible. So please, 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 please use empathy, not sympathy. You can sympathize a little bit, but empathize more so than showing sympathy. It goes a long way. And I hope everybody has a wonderful week 7, and we are almost done. Yay!